Dr. Saskia Sivanathan is the founder and CEO of the Brainwell Institute and joins us now. Doctor, thank you for joining us.
Thank you for having me.
Why does it take so long for a dementia diagnosis in this country? 2 years seems an incredibly long time.
It is, especially given the complexity of dementia and the management of it. And unfortunately, there are a couple of reasons for this. The first is that there is a lot of stigma around the disease. Dementia and Alzheimer's disease, which is the most common form of dementia, is often seen with fear and trepidation. People don't want to be diagnosed because they see it as a life-ending disease, almost a death sentence. And because of that stigma, people might not always be willing to come forward to get the diagnosis. But on the other side of that, our health system is really not well prepared to provide the diagnosis. Only about 41% of family doctors feel prepared to diagnose or manage dementia. And this makes it incredibly difficult then because primary care physicians are the entry point to getting the diagnosis.
And I imagine an early diagnosis can alter alter at least your path, not necessarily the outcome, but alter your path though.
Absolutely, it can. In fact, I'm at AAIC today, which is one of the largest conference focuses on dementia. There are 11,000 delegates here. And we're seeing all of this extremely wonderful research around new ways of diagnosing dementia, thinking about dementia in terms of rehabilitative care, new therapies and drugs. But all of those really are most effective when someone is diagnosed early and diagnosed in that specific window that allows for those therapies to be implemented. And unfortunately, if you're waiting on average 2 years to get the diagnosis, things can have progressed quite significantly. And what we are lacking here is a pathway through the health system. So what we've heard from family physicians as well is that even if they are able to diagnose dementia, there's no next step. What do they do next to refer a patient where they can access those supports? And that's really what the report has highlighted, where Canada is falling behind in implementing a dementia strategy that provides coordinated care and a pathway through the health system, which we've done for other large diseases like cancer and stroke, which means it's possible to do for dementia as well.
Okay, Doctor, thank you very much for joining us today. Appreciate it.
Thank you for having me.
Dr. Saskia Sivanathan is the founder and CEO of the Brainwell Institute.